for listeners, what would you like them to understand about these two groups of people?
Well, I would want them to understand that um, they feel like they don't fit in, for one thing. Both groups. I mean, the first group, the clergy abuse people, they have a lot of trouble finding any kind of spiritual home, and of course they carry a lot of shame, um, and blame. I mean, a lot of them, even though they were kids, they blame themselves and so on. And really the same thing with the veterans. Okay, a lot of veterans that I've dealt with, they carry blame, they carry shame. Um, they will tell me stories about changing an assignment with another soldier and then having that soldier get killed in their place and so on. Um, and it's not that they want special treatment. It's kind of like one time, one veteran told me, some of us don't like being told thank you for your service because it kind of puts us over here, makes us like separate. You did that. That was your service. And we're over here and we're fine. So I don't do that as much. Um, and so really both groups, they just feel like they don't belong. Obviously the first group, the clergy abuse group, they have a lot of trouble finding any kind of spiritual home. The second group, the veterans, just have trouble fitting in. They come back from horrific kind of events, and even within their own families, they'll feel different, and so they feel like they don't fit in. And so to feel some acceptance, to feel um, some loving attention, makes a great deal of difference to these folks. Um, and the one thing that neither group wants is pity, which I think is why some of them react to this "thank you for your service" thing. Some of them interpret that as pity, and they don't want that. Um,
Yeah.
and really, the one common theme with trauma victims in general is that um, they do and they don't want to tell their story. You know, they don't want to tell it because they fear judgment. Um, they do want to tell it just to get it out, just to get it out, to put it out and try to be done with it. And so it makes a great deal of difference for both groups to feel like they're dealing with somebody, whether it's a therapist or not, who doesn't judge them and more than anything is willing to just listen and not tell them what they need to do to fix it all. I mean, a lot of the people that I've dealt with are very angry with God. Um, and obviously there was people I've dealt with who, like one man I dealt with, he said, how can I believe in a God when I saw my best buddy burn up in a vehicle? How can I believe in God that will permit that? Okay. Which is for many people that have suffered not just trauma, but like the death of a loved one suddenly, unexpectedly. Um, it pulls us into what is God part of this in any way, and if so, how so? Okay. Um, I, you know, I'll share this story with you, and maybe this is off track, but that's all right. That's your problem to figure it out.
The joy of this podcast is the freedom to go off track.
Okay. Well, this just illustrates the spiritual challenge of all of this to me. The other thing that I did in the late 80s and into the 2000s was I treated AIDS patients, um, which was extraordinary, an extraordinary experience. And one time this boy was brought in, he was 12 years old, okay, and he had AIDS. This was before they really made progress with the medication and so on. And so he had AIDS, and he was very anxious, which I thought was pretty understandable. So I talked with him and his mother for a little while, and then I asked his mom to step out so that I could talk to the boy alone for a bit. And I said to the boy, and he knew a lot about his illness. He had read about it, and I said, I'm really impressed. You've educated yourself quite a bit. I said, do you have any questions that I could answer for you? And this boy lived in a faith-based family, Okay, so I said, "Do you have any questions?" He said, "Yeah, I have a question." And I said, "Fire away." He said, "Why did God do this to me? Why did God do this to me?" He said, "I didn't do drugs. I haven't had sex. Why did God do this to me?" Okay. And that to me was a stunning question. And I didn't have a simple answer for him. And I tended, ever since then, I've tended to be suspicious when people have simple answers. I dealt with a veteran recently, and he was in Walter Reed Hospital after multiple explosions. And we got into some of these spiritual issues of the trauma. And he said, Doc, I had somebody come to me. I don't know whether they were a chaplain or not, but they came to me a while ago and they told me, well, this has happened to you in Iraq for a reason. God wants you to learn something. Well, he got furious. He cussed the person out and kicked him out of his room. Okay. And so, that's a question that I've struggled with personally, having grown up in a family that lost children. And I think anybody who has been through trauma struggles with. So that, it kind of challenges us, especially if we do have a spiritual foundation of, well, what do we think about that? Why, it's the why, the big why question. And I think anybody who's gone through any kind of trauma that is open to a spiritual foundation is going to encounter that question, why? Why has this happened to me? Or why did this happen to, why did my mother get cancer? And so on and so forth. Why did my sisters die? And I at least don't have an easy answer to that question.
How do you respond when someone asks that question and wants to go the spiritual route with you?
Well, was helpful to me, quite frankly, was Harold Kushner's books, When Bad Things Happen to Good People. And of course, in that book, his position, which is not necessarily, it is what it is, but his position is maybe God doesn't do everything that happens to us. Maybe some bad things just happen. Okay. And maybe what matters is knowing that God may not have made this happen to you, but God is walking with you. Okay. God is walking with you through this. God is with you in your pain, which is what I told that boy. And he didn't question it, and he didn't get mad. I'd like to tell you it had a dramatic impact, but I don't know, because that boy died maybe 2 months later.
Lord have
But
mercy, man.
obviously his question stayed with me, and he's not the only one, but just such an innocent child asking that question. And yeah, I mean, it's come up many, many times. I think anybody that does any kind of counseling or ministry or whatever is going to run into that. Why? Why has this happened?
We mentioned the Christian tradition. Saint Francis of Assisi himself, and maybe you wrote about it actually, but I've heard several theorize that he probably had
He,
PTSD.
he has to
So
have. Yeah, he has to
yeah,
have.
can you go a little bit
Sure.
into that and how a reading of his life perhaps and again we're not being prescriptive here. We're not saying
No,
like
no. That's just
this is exactly what you have to do to heal. However, I
right.
wonder if there are some things from his life, going back to his own PTSD, that we
Sure.
can glean to take with us on our own journeys toward healing.
Well, I mean, to me, in reading his story, there's no doubt but that he had to have had PTSD. He was a combat veteran. He was a prisoner of war. Um, and it's clear in terms of what we pieced together that when he came back, when he was released from his prisoner of war status, and he came back to his village, he was not the same person. He apparently was described as someone who just was very joyful and outgoing, maybe too much initially, loved to be out in the woods, loved to be out in the fields, and all that changed when he came back. And in fact, he was going back to battle. He was going back to his life as a soldier when he had what 12 steppers would call a spiritual awakening. Okay. And I think obviously at some level he was open to that. As wounded as he was, there was some part of him, maybe it was just a tiny part, that in essence was saying, heal me, Lord, help me. And so when he was going back to battle the second time, he had a spiritual awakening, which changed his life completely, changed the direction of his life completely. And I think, I mean, that's one lesson to take from his story, is that even in the midst of anger, in the midst of the storm, in the midst of darkness, if there's a part of us that can at least be open to a spiritual awakening, it can make a tremendous difference.
Well, we have covered a lot of ground, Dr.
Yes, sir.
Patterson. What did we leave out? Is there anything else that you wanted to hit on?
Well, reference PTSD, there is a very, very good website. It's called ptsd.va.gov, G-O-V. And it's not just for combat veterans. It's for anybody that suffered trauma. And it's just got a wealth of good guidance, good information, techniques of relaxation training, and so on. The one thing we didn't get into, which I'll cover quickly here, is therapy. Okay. Um, does therapy help trauma? Absolutely. There's some good trauma therapies out there right now. And I think the only things to keep in mind, sometimes before people get into productive trauma therapy, they need to address a substance or alcohol issue, because that's how a lot of people cope with trauma sometimes. So that's not uncommon. Um, but I think that if, if they're having trouble managing the anger, if they're having trouble with nightmares, they're having flashbacks, or they're having trouble with depression, then yes, it's a good thing to reach out and find a counselor, and to not be afraid to ask questions of a counselor, like, do you have good training and experience treating trauma? Okay. Because therapists can say, yes, I treat trauma, and they may not have a whole lot of experience doing that. And people owe it to themselves to have somebody that knows what they're doing. And if they want to have a spiritual perspective incorporated, to not be afraid about asking about that. To me, I would never push any kind of beliefs on anybody, but I certainly felt it was appropriate to ask them, how are you doing spiritually with all this? And some people are drawing on their faith to get through it all. And so to have a counselor or a therapist who is sensitive to that issue can also be helpful. And finally, to not be afraid to ask if the therapist is going anywhere. Because I know a lot of people that go to places like the VA get frustrated because the counselor changes, especially when it comes to healing from trauma. That's a problem. So, not towards the end of my private practice, people would come in and they would see that I had a little bit of snow on the mountaintop there, and they would ask me, "Are you planning to retire anytime soon?" I always thought that was a fair question, because they didn't want to start dealing with something and then have to start all over with somebody else. So that's also a fair question. Um, and yes, I think that there are good therapies out there that can be helpful, and also to be wary of people who. There was one other therapist in town who was telling people he would cure their trauma in 12 sessions, and there's no therapy on earth that can do things that quickly. I wish there was. I'd go sign up for it.
Yeah.
But there isn't. So to just be aware of people who claim those kind of things. And then finally, here's my last piece of advice, and I'll let you go, okay?
You can keep going as long as you want. This is great. I could talk to you all day.
Has to do with the story. And I think this is ultimately, you had asked me previously about families and people, support people, and so on. And yes, that's important. It helps for those people to educate themselves about the symptoms of trauma and so on. For instance, it's not uncommon for a trauma sufferer to go to a restaurant and need to sit with their back to a wall and being able to see the exit. Okay. That's okay. That's okay. There's nothing wrong with them doing that. And so it does help for families to understand a little bit about the trauma that their loved one is going through. And then finally, it's summed up for me with, I've often viewed most of my clients as teachers. And I had a wonderful, wonderful lesson years ago. This lady came in and she told me briefly what her issues were. And this was when I was a young therapist. She told me her issues briefly, and I immediately began to pontificate on why I thought she had this problem, what she needed to do about it, etc. And she listened politely for about 10 minutes. And then finally, she just put her hand up like this and said, "Would you please be quiet and just listen to me for a little while?" Okay. And I, of course, said, "You got it." And what happened then was wonderful. She sat there and talked for about 20 minutes. She worked her way through the issue herself. Okay. She talked her way through it. She reached an end point. I said something really profound like, "Well, sometimes you got to do what you got to do." And she stood up and thanked me and gave me a hug. And then I got some feedback a few months later that she found this very helpful. She had resolved her situation. But I was the one that was left with the gift because of her telling me, "Would you please be quiet and just listen to me?" And that's something that we can offer to anybody that's been traumatized. If we can, it means, yes, you listen to some hard stuff to hear. But a lot of these folks of trauma of any sort, all that they really need is somebody to listen to them, who's willing to just sit down and say, "Tell me how you're doing. Tell me what you went through." And is really willing to listen without judgment, without, "Well, if you just pray hard enough, you'll be fine," or, "Well, if you just do this, you'll be fine." No, to just listen. And that, to me, is the cornerstone of really any kind of wounded healer work is keep my mouth shut and just listen.